Hello, this is Integral Dose Podcast. My name is Atika.
Hi, my name is Sarah.
Another day, another dose. This is the podcast that covers all things related to, integral to, radiation therapy. As radiation therapists, and even as humans ourselves, we experience stress and we get overwhelmed some days. Some days, we're barely getting through the day. So it's important to know the state of our mental well-being, acknowledge it, and find healthy ways to cope.
Today we have with us Zubaidah and Naafi'ah, our colleagues who are also radiation therapists just like us. But more interestingly, they have special interests in this topic. To add on, Zub has completed her degree in psychology.
Not really.
Yes, you heard me right. A degree in psychology. So maybe Zub, you want to share with us more about how you go about taking a part-time degree in psychology. Sounds interesting though.
Yeah.
Okay, I completed my basic degree in psychology. So actually, I'm still doing my honors year. Yeah, so I'll be doing my capstone this year. Yeah. So actually, not really fully completed yet lah. I just celebrated early.
And would you also like to share how long you've worked with us and the actual name of the degree that you got?
So I've been in DRO, NCC for going 14 years.
She's
So-
my senior.
Yeah. So I started doing my psych degree in 2021. So that, during that COVID lull got me thinking about mental health and basically about work psychology in general. So psychology has many different areas of specializations. You have forensic psychology, and of course, you probably heard about clinical psychologists. That's where most psychologists have to have an area of expertise in to become a clinical psychologist. So my special interest is actually work psychology, but actually the proper term is called industrial/organizational psychology.
Oh.
Yeah. So what got me interested was, I guess, a series of workplace happenings or events that got me thinking about how we interact with the system around us lah. So basically, there's a lot of cognition work. What's the cognitive processes, with your cognitive load, switching tasks. Some people say, can you do multitasking? Because actually multitasking is technically not possible. There's only a small percentage of the population where they can effectively do multitasking. But most of the time, what we think of multitasking is actually task switching. Yeah. So that kind of thing is very cognitive psychology, which is part of a whole area of psychology that is known as human factor psychology. Yeah. So that's one part of IO psychology. Then the other part of IO psychology is basically about personnel psychology. I think in military you have recruits, your NS men undergoing psychometric testing, right? So basically they're trying to find a good person, job fit or person. I guess from that assessment itself, you can sort of tell where to put these people in, which area of military. Yeah, so that's one aspect. So MINDEF hires a lot of organizational psychologists. Yeah. Then the other aspect is basically psychologists who are in change management, workplace culture. Yeah.
That's very deep.
Yeah.
It's very specific type of psychology study.
That is very, very specific. Yeah.
We also have Naafi'ah with us here today. Would you like to share more about yourself and why you're interested in well-being in general?
Hi everybody, my name is Naafi'ah. I've been working for I think this is coming to the 5th year, entering the 5th year of work. I would say well-being in general, I wasn't introduced to it until a conference that I attended I think a couple of years ago. But I saw an interesting workshop where it was conducted by an organization called Happiness Initiative. And what the workshop was about is basically how we can use card games or play to discuss mental health and well-being. So I just attended the workshop because it sounded interesting. And I guess that opened up the world of like well-being to me. After I came back from the workshop, I actually started to pay more attention to my colleagues, pay more attention to my surroundings, and also to myself regarding well-being, I guess. Yeah. And that's how like the topic of well-being like grew on me, I would say. Yeah.
How do you find this workshop particularly like? Was it something that you purposefully researched on, or did it just like, appear in your email, like advertisements or anything?
As in, it was one of the workshops that you can sign up for during the conference.
In the conference itself?
Yes.
I see.
Yeah. So I signed up for it because it sounded interesting. Like, wow, how can you play cards and talk about well-being?
Yeah.
Yeah. So
That's
yep,
nice.
that's why. Yeah. And the sort of stats that they actually presented during the workshop was quite like, I would say, eye-opening lah. I mean, like it's very applicable to like a real world situation like now. Yeah. So I just pulled up these stats like yesterday. So to share with you, National Youth Mental Health Study in 2024, right? They did the study. So 1 in 3 young people aged between 15 and 35 years in Singapore, they actually report experiencing severe to extremely severe symptoms of depression, anxiety, and or stress lah. So if you look at this age range, 15 to 35, that's like almost 1 or 2 colleague in every treatment room. And the stats being 1 in 3, that's like you confirm have one person in every treatment room that's going through some sort of symptom that you may not even know on a day-to-day basis, Yeah. So to put that into perspective at workplace, that's how important it is actually. Yeah.
That's true. Wow, that's very, very interesting. So, apart from that, Naf also pointed out about depression, like 1 in 3, correct?
1 in 3. Yeah.
1 in 3 people. So that's actually very profound. I don't know. Like psychology is really very, I wouldn't say general, very specific in terms of specific names or terms that you use. So maybe you want to share with us about the spectrum or well-being in
The mental health. So like I think as Singaporeans as a society, you think of mental health is like it's either you're xiao lang or not. Right? So I think we sort of have to like normalize mental health and well-being as a spectrum. It's not that just because you're struggling doesn't mean that you have clinical diagnosis, you're clinically depressed lah. So you definitely have a subset of population that will have clinical depression. So these people would have been, referred accordingly. So like if you go through the public system, you want to seek mental health support, you can go to a polyclinic. Okay, then they will refer you according to the psychiatrist, and they can conduct some assessment, screening tests to see if you have depression. Then they can refer you to a psychologist lah from there. Yeah. So that is the public route. Then you also have like you go to the private route, right? There's no need for like referral lah, because private, right? Yeah. But then again, I'm not saying that just because you are experiencing some low moods, right, doesn't mean that you shouldn't diagnose yourself that, I've got depression. I mean, there is a spectrum. So like you have like severe. So like severe is like you're having a disorder. Then moderate, maybe you have some struggles. Mild, and then healthy maybe like normal functioning, you're thriving. So just because you're having some anxiety or feeling sad and you've been consistently having these moods, right, you can just approach for help lah. Yeah. I think for us in Think Health, we have intellect.
Yes.
Yeah. So there's those quizzes, right? I don't know if you guys do to assess your
I have tried.
your mental health. Then you can actually book an appointment with a counsellor. Yeah. So it's okay to struggle. Yeah. So it's also like physical health. Like you go for checkups, right? So you don't wait for your mental health to spiral into a state of depression or like an actual mental disorder. Yeah. I mean, there's a lot of mental disorders. There's a special book called DSM-5. It's a guide for professionals to diagnose or assess someone with the specific disorder. There's a lot. Lah. Yeah.
Yes.
Yeah. So basically, I think as of now, we just want to like normalize seeing a counselor, seeking mental help, and like making this part that is not like safe to share.
Yeah.
Yeah, because sometimes we do need like support. Yeah.
Yep.
And if it's beyond our own resources to cope, it's okay to seek professional help.
Yeah. So it's just like when you're physically sick, when you have just flu, then we'll straight away go to a GP
Yeah.
or polyclinic. So I guess it's the same message if you're already experiencing some form of anxiety or like low moods over a period of time, I would say, then it would be good to look for a counselor first or find ways to get help.
Yeah, because like for us especially, we have a free resource like
Yes.
internet, so do make full use of it. I mean, if you don't want to go to the physical location, they will offer like online sessions. Yeah.
Yeah.
To touch on what Zub said, right, it's more so like having awareness as like looking at mental health as a health that you must be taking care of. Like just as like how much attention we pay into like nutrition, we pay to like physical health, you know. So it's the same thing. It's having awareness over like mental health being something that you should actively be putting effort into. It shouldn't be something that you realize like there's an onset of symptoms, then you look at it, you know. Mental health should be something that you are trying to strive or grow towards too. The way you look at it, the perspective, the awareness, I suppose that is what actually is changing in the scene amongst Singaporeans already. There's a lot of initiatives and people, organizations that put out initiatives to change this perspective on mental health already actually.
Yeah. I agree. I mean, like what Zub also said, with this free resource available for staff of Sing Health, I think that puts out a very good message that this is something that is being treated as important as our physical health.
Yeah.
Yeah.
But some people also might think that if I see a psychology, it means I'm very weak. You know, I'm a weak person.
Yeah.
So they might not even want to approach a psychologist or a counselor, for example. Yeah,
The stigma,
Yeah, the stigma,
referring to the
right.
stigma that's tied to it. Yeah.
that's right.
Which is what we want to break. Is that what we call break the stigma? Because we want to be more open about talking about seeing a counselor rather than keep it hush hush, like because of our fear of how people will see us.
Yeah. Yeah, so this is the stigma problem, like what Now said, bringing that awareness that mental health is a spectrum, just like your physical health lah. And doesn't mean your struggles is a disorder. I don't know, I guess the fact that people think that, oh, if you see these mental health professionals, then you're not strong, right? I mean, what I would argue, being able to seek help is actually a sign of strength.
That's right.
Yeah. And also maybe is, I guess, being in an Asian society, it's just that you're being taught to be independent and productive very early on in age. So this is something that is, a very crystallized mindset amongst us. So how can we, reduce the stigma? I'm also not too sure. I guess the government have its own national mental health strategy. They've been planning that for the past few years, right? And you're seeing like a lot of edutainment on CNA also. Yeah, I hope this kind of like programs help lah.
That might be one of the ways to reduce the stigma lah.
I guess that the talking more about it also helps. Like, you make it like a more inclusive and open, like a safe culture to share lah. Yeah. But of course, it's within your right. Like, how safe do you feel to share? We don't force people to like, get out.
That's right. So the first thing is to have a safe space lah. Right?
Yeah, safe space.
for people to come out and then share openly about their struggles, their mental well-being. All right, that's great.
Okay, so just now, Sarah was talking about depression and how to identify someone who might be undergoing depression. Speaking along that topic, right, I've also heard of like people who may have depression, but they're also like high functioning. That means they still go about their day. So it might be very hard for us to, from the outset, like when we look at them, we may not be able to identify or know that they're going through depression. So what's your take on this?
Okay, so like usually when they approach a mental health professional, counsellor, or like a psychologist, the psychologist will do an intake interview lah. So they may actually do some screening procedures, administer some like screening skills. Yeah. So the thing is, I'm not the well trained in this specific discipline of psychology. So basically, this is clinical psychology. The minimum training for anyone to be qualified as a clinical psychologist is actually a master's degree lah. Yeah, but from what I know so far is that during the first session, the counsellor or the psychologist will do an intake interview and assess you accordingly lah. They may administer some self-report questionnaires to assess how bad is your depressive symptoms or your anxiety symptoms, and whether you're functioning well at work and socially lah. Yeah. So I mean, maybe some people are exhibiting like mild symptoms of depression. That's why they are still able to function well. Yeah, but you know, you won't know until you do a holistic assessment. So other than like screening tools, the main thing that is going on during interview is the actual interview, where they find out more from the client, like what's their social background, what's their job like, see where the stresses are. Is there any like history of mental health disorders in the family? Yeah. So it's like a holistic assessment of that person lah. So through the interview, that's how they qualitatively collect data about the client lah, like how they are coping in general. Yeah.
Speaking of coping,
Coping.
since your degree focuses on, as you mentioned, like industrial
Okay, so
psychology, right?
now
Yeah?
that is like a specific area of interest, but my degree is very general. Yeah, so
okay.
yep, I take very wide spectrum of modules.
Previously, we recorded an episode where we talk about our emotions
Yes.
at work. If you remember this, Sarah. I think in that episode, we talked about how our teammates being very understanding helped us, but we didn't really explore coping strategies.
Yeah.
Maybe we can ask Zub. What are some of the coping strategies? Or maybe we can all share how we cope with our stresses, and then we can get Zub to comment on it.
We go round table or what?
Yeah.
Maybe
So
we start with
maybe now,
Naaf?
how do you cope with stress at work?
Cope with stress at work. In general, I feel like coping with stress for me is always like sort of putting my mind elsewhere. So the typical thing is to like go to the gym or go like take the energy out somewhere else, which is like doing something that I like. Yeah. So physical activity, I would say, is like one coping strategy that I think a lot of Singaporeans have turned to now.
That's a very healthy coping strategy, I feel.
Yeah.
Okay, how about you?
Me, I think having my cats at home, going home to my cats, it helps to calm me down and actually takes away the stress, sort of. Like, you know, when you look at them, you just forget about the world a little bit. Like, oh, let me hug you, let me hear you purr. Yeah. And although I do sometimes go into mindless scrolling, like what Zub mentioned at the other start of this episode, sometimes like you're just on your phone, then you watch like cat videos. It's quite cute, you know.
Yeah, and you share that with me.
And Sarah also likes to send me cat videos sometimes of like chonky cats. Yeah, so I think that's my way of not thinking about the stress. Whether it's healthy or not, I do not know.
if I might add, like, I know I read online that, the cat's purring is supposed to help you cope with the stress. Like the purring frequency actually helps to lower down cortisol. I don't know if this.
If we find a paper on that, we might add that.
But it's a nice thing to hear from the cat.
But if your cat is not purring, then
You're so lucky to have cats purring at home. I got children screaming at home. So it's on to my stress. Okay, no lah. My children are okay. So how do I cope stress? After being a mother, it's like 24/7. You juggle between two roles, like from work and then home. Sometimes it takes a toll on you lah, because you had a long day at work and after that you come back home, is another job role switch, Suddenly you have to like quickly switch yourself to become a mother. And then you don't have time for yourself. So I think the coping mechanism would be, I think my husband helps a lot at home doing chores. So while I'm attending to the kids, he will busy himself with the chores. So knowing it at the back of your mind, you have someone who is supportive, makes you feel like, okay, I have someone who supports me at the back. So I don't feel really that stressed. So that's how the coping mechanism is, that I know there's someone supporting me at the back.
so like you feel reassured there's someone to share the load
Yes.
of the things to do at home.
Yeah, correct. So like all the things that needs to be done for the next day, has already been done. Because I would attend to my kids, like my boy especially, then like have to sit down with him, see the books, see the homeworks, spellings, everything. So yeah, you have a short period of time just to be, just 1 hour with him, and then but my husband is helping, with the rest of the things at home.
But if I can ask, like, if you are given just 5 minutes of alone time, what would you do?
Watch cat videos.
What tops up your soul?
Yeah, something that you would love to do
What's
for
like
yourself
very
or on your own.
nurturing?
I have no idea actually. It's a good question, because like you immerse yourself with everything that even 5 minutes is a luxury. Yeah. So if I have that 5 minutes, I think I will take a warm shower. Warm shower, like just be inside the, maybe not bathtub, but just in the shower, just okay.
Wow,
Yeah, that's it.
interesting.
Yeah.
I think that helps though, like taking a shower.
Right, taking a shower, just just to relax, slowly relax. 5 minutes is fine.
If only it could be longer.
Oh, I want it to be longer, but
5 minutes enough.
of course not enough lah. But what if you asking me what if I want, what is the thing that I want to do, right? Yeah, maybe take a warm or hot shower.
That
That'll
will
be
like
nice.
relax you and calm you down away from all the stresses, right? Yeah.
Yeah.
Maybe that's your coping strategy.
Yeah, I think like it's quite default lah. A lot of us will go back and look on the phone and scroll, or like play games. I guess that's some sort of like avoidant way of coping lah. Yeah, sometimes you do have like a hard day at work, right? Even though the stressor is gone, you actually still need to complete your stress cycle. So like you have a stressful situation, you have a lot of like the cortisol in the body, right? So one way that I think one of the most effective ways is actually exercise.
Push the
Exercise.
energy out.
Yeah.
Very good enough.
Yeah.
I'm pretty sure like a lot of people have turned to exercise as like a stress reduce lah. I mean, it is clinically shown to reduce your stress as well. So why not, right?
The dopamine.
But have you ever have anybody who cope with stress by eating a lot?
Have. Sometimes I think that when I'm stressed,
Yeah.
I try to look for food that like comfort food.
Oh.
Yeah.
that's
But it's not the kind where I will eat a lot or I will. But then there are also times where I'm so stressed I don't feel like eating.
true.
So
Yeah. I guess that's where the term eating out your emotions come from. Right?
is it?
Yeah. Like stress. okay, I need something to feel better, so I eat.
Yeah.
Yeah,
Like sometimes I just want to reward myself after a hard day with like
Yeah,
an
that's
ice
true.
cream. Or
yeah.
like make food, cook food, or order food that I really want to eat. Yeah, I don't mind splurging for
Yeah.
that dinner.
Yeah, I guess another way I think a lot of us women like to do is to actually seek social support lah. So this like emotion based coping strategy. Yeah, like when you vent or share with someone else, that actually kind of make things better. Like it helps you to process the problem.
Yeah.
That's
Yeah.
true. Very true.
do you guys like
I do.
do?
Yes, of course. I mean, like I said, I share everything with my husband, right? So
Yeah.
even like some days when I feel very down or something, I will share with him lah. I mean, the good thing about him is that he listens and he just, oh, okay. And then he don't judge you, right? He don't judge you. Okay, come. You want hug? Okay, come.
But yeah, so there's a thing like you have a safe space.
Yeah,
like
safe
he reserves
space,
the
yes,
judgment.
yeah,
He
that's
withholds the
right.
judgment. So I guess that's important. Then there are also people when they come across like a specific stressor, then this is what we call the problem-based coping strategy, where they just come in and try to find solutions lah. Like this, like problem-based, like they just tackle it at the root of the problem. Yeah.
But then there are some problems where you can't really fix. Like it may not be within your control, but it still stresses you.
Yeah, there
Like
is lah.
example?
I guess not all problems are solvable. That's what she meant.
Yes,
And then
yes.
I guess that's just part of life. Yeah, that maybe it's a problem that is not solvable in like a short spell of time. It's only going to be solvable
Later
later
or like,
on. Then what do you do, right? During this, I guess you can explore all those that we mentioned.
yeah.
So like look at what is like within your control.
Yeah.
If it's not solvable means maybe it's not within your control. So I guess changing the way you look at it.
Managing your expectations.
Now
Yeah.
is so practical. I like.
Yeah, that's true.
But I think for someone who sometimes like to have that control, like me, I used to want to control a lot of things.
Uh-huh.
And when I feel like I don't have control over it, I get very stressed. And I will still try to find ways to overcome it. But I know I cannot do anything about the situation because it's not within
Your
what I can do already. I've already done everything that I can. That sometimes makes me feel helpless. And I'm trying to recognize that. And I'm trying, whenever I encounter such situations, I mean now lah, I feel that I will tell myself, it's okay, you already did what you can. It does stress me out, but I think I get over it a lot faster than last time. If not last time, I will really react to the stress almost immediately.
Like there's like a lack of resource in which we turn to like strategies. Like within this circle, right? We've mentioned like maybe less than 6 coping strategies, but there's like actually so many
Yeah, there's a lot.
strategies that you can use to cope with stress, but we don't know how to do it. Yeah, we turn to like we look at what our parents used to do, or like our siblings do, or like what majority of people do, and we just do to try to cope with the stress. But I would say we actually haven't explored like so much of things. Typical things like maybe journaling, you know. Yeah, so these are the things that like keeps coming up. But like simple things as just like writing down your thoughts, or like whatever that you have achieved, or whatever that you can do but couldn't do it, or whatever that you've already done about the situation, you know, like penning down your thoughts. Yeah, these are also like simple strategy. The most basic strategy is actually breathing. So you just need to sit and breathe to cope with
Your
the stress.
box breathing.
Yeah.
So like you inhale for 4 seconds and then hold it for 4 seconds and then like exhale slowly and then pause. Yeah. So that helps to regulate your nervous system lah.
Yes, correct. Yeah. You just need to widen your scope of strategies, maybe. Expose yourself like, oh, this strategy used to work, but now I don't feel like it's working. Then try new strategies.
something else.
You know, like that lor. Yeah.
I think like you like to do watercolor, right?
Oh,
Yeah. So that's one way also.
I heard this too.
Maybe you should buy an iPad and then you can watercolor inside the iPad.
I already have a tablet at home. But yeah, I really stopped watercoloring since that time. like I said, I haven't found the time to go back to it yet. I still have the materials at home. But yeah, I've got busy. Back then, I didn't have 3 cats. Now I have 3. So like when I go home, instead of kids, I have to look after my 3 cats.
Yeah.
I guess like I think when it comes to self-care, we tend to not plan for it.
Correct.
Yeah, so like actually you need to book time and top up also lah.
True,
Keep this space. Then I think for me recently also I signed up for PT.
PT, as if
Yeah, so
physical
that's-
training.
Yeah, so that's one way of
Personal
feeling.
training.
I mean, I get the health benefits as well.
Yeah.
I mean, the physical health benefits are, yeah. So I think it's important that in the midst of, work and social life, right, we easily forget to take care of ourselves. Because I think we've been so conditioned to take care of everyone else except us. Because it might seems like a bit selfish.
Yes.
Yeah.
Oh, that's so
That's
true.
the
Yeah,
thing.
so-
So
Yeah.
I feel like if I were to set aside time for my watercolor, but someone else will be like, why are you doing this kind of thing? So it's a bit of a struggle to set aside time for a hobby when someone else might see it as, oh, but you got so many things to settle. Why don't you settle all those things first and then do your hobby? But sometimes these things that you have to settle is like never ending. Every day you have to do it. Yeah. So
It's like energy, right? It's like when you do these kind of things, then you have more like battery to spend on like like less pleasurable things.
yeah.
Yeah.
I think it's probably something that I still need to work on.
It's like I think like often people think like too far stretch when it comes to like self-care. If I ask like what's like your self-care like I think like the first thing people think is like I want to go somewhere like out of Singapore, travel is my like go to. But the thing is like that is something that is like I would say it's not every day. That to me that's not like self-care. That's like your mandated
Vacation.
care. Yeah. Self-care to me is like it should be every day. Something that is like your non-negotiable. Yeah. So it doesn't have to be like okay. So if like let's say you have Saradi's like hectic work, right? Maybe it can't be every day, but within that week, maybe she like I don't know 3 times a week she has like her own time to herself. I don't know. So like keep going back to what Zub said, right? It should be like scheduled. The idea of it being like that this is time that's put aside for yourself. Yeah. And to remove I guess the tag of it being seen as selfish lah. Yeah. This is what prevents people from moving from normal to mild stress to like suddenly become moderate and then severe stress already. It's when you don't address it and keep it within this normal and mild stress, I guess. Going back to that 4 zones. Yeah.
That's true.
Yeah.
Maybe after you mentioned it, maybe I do have one day, but that is after like 4-5 weeks that I have one day of like just myself alone. Probably go to like self appointments, like doing your hair or something like that.
I think
Right.
it counts.
It's a self-care.
Yeah, that is okay here.
But after 6 weeks lah, or 7, or maybe 2 months.
I think like going back to what Naf mentioned, I suddenly thought actually like we're thinking like so much like exercise or watercoloring or even gym. There's one thing that actually we all do every day. I think for us Muslims is like we do pray 5 times a day, right? So that's also a way of managing it. Then I don't know, I think for Christians they go, I mean those who are religious, they go to church every Sunday morning. I think that sort of helps like believing in a higher power that you don't have to shoulder everything. Yeah, I think there's some sort of like self-care as well. Yeah.
But for those who do not have a religion, then would it be something akin to like some form of meditation?
Yeah. There's a guided meditation that you can do, like basically just you can search it on YouTube. Actually, they will move you through like the whole cycle of guided meditation. Personally, I found it very useful before doing guided meditations. I've like physically seen the difference like before and after. You know, sometimes when you do meditation, it's very hard to relax.
Yes.
You think you are meditating, right? But your mind is just racing so much. So when you do it with such a guided meditation and not just like on your own, I've seen such a huge difference in like, I have no thoughts at all.
Wow.
Like my body is like just in a calm zone. I'm not breathing heavy. I'm not like sitting in like a tight posture or what. I'm like completely relaxed. So I would highly recommend people to try this guided meditation. It really works though. Yeah.
Yeah, so like touching back on that, someone shared with me, before we jump into meditation, let's say you're really, really like agitated and like, you know, very high strung, it's not very productive to just jump into meditation straight. Yeah. So what she recommended was, you know, to actually process the energy, like in a way to get you to a state where you're more calm so that you can easily do the meditation, I wouldn't say rituals but exercises. Yeah. Because like sometimes like you try to meditate, right, while you just
While you're angry.
you're like
Or-
while you are, you know, a bit like a lot of things happening in your head, it's a bit hard to go to a state where you are able to be free of thoughts or be mindful of what is going through your brain lah. Yeah, so that this is advice that she gave me lah. Yeah.
But how does someone go to that state? Like, how do we reach?
Like maybe just walking. Yeah. Like last time after work I would like not. Okay, I would like drop off somewhere like very far from home. And then I would just walk. Yeah, I think there are studies that say that walking do help.
I've actually done that before. I've done the same thing. So I just try to take the longer route home. I think to me that is like my extra maybe 10-15 minutes to myself. And then like when you walk, you could feel the breeze. If there's a breeze, if not, you just feel a sweat. And then like you hear the traffic.
I was just going to say like you're moving yourself out of that overstimulating environment. I guess like it's the easiest. I mean, you don't expect Saradi to be standing inside the room with 2 screaming kids and then suddenly meditating. Like,
Yeah.
it's going to be weird,
Yeah,
right?
already.
Yeah.
So
I can imagine.
Like, wait, let me meditate first. Yeah.
Okay,
So,
You need
moving
to
yourself.
get them to stop screaming.
Yeah. Or you move out of the room. So, yeah.
Yeah, but I want to emphasize like what Nav brought up, like, you know, not if we don't take moments of this self-care and then you go through like, you know, when you use something like an item and then you just keep using it and it will end up like bit bang up right after a while. So like it needs to have like, not saying that we are like items lah, but yeah, we need to have rest so that, you know, we don't move along the mental health spectrum to a state where we are struggling lah.
Is it proper to say there are different type of health professions, or is there a difference between counsellor and psychologists?
So within the mental health profession, right, there's quite a few. There's not only counsellor, there's not only psychologists, there's also like music therapists, art therapists. Yeah. So these are all under the umbrella of mental health professions lah. But I guess we just stick to counselling and psychologists first. Yeah. So they are basically differently qualified, but what they both can do is talk therapies lah. So for counsellors, right, they graduate as counsellors. So they need to be, I'm not too sure, but I think they probably need to register with the Counselling Association in Singapore. So they have to have training in counselling and what are the different types of talk therapies they can do lah. Because even if that person is a psychologist, right? They are not able to do all the different types of therapies. Like they have also have like different modalities like us. Yeah. So for the difference between counsellors and psychologists, right? Counsellors, they don't do assessments like psychologists. So psychologists on top of the top therapies, like I think you probably heard like schema therapy or like CBT, cognitive behavioral therapy. These are example of thought therapies. They also do assessments where I think you see this most in like educational psychologists where they administer tests to see if like this kid is whether they are autistic or not. Yeah. This is example of assessment lah. Other than that, like other types of disorders. So they can administer assessments to see if like this person whether they meet criteria to have this diagnosis lah. Yeah. Yeah.
So does your degree?
No. No. So psychologists need to have a minimum of master's degree. So as long as you don't have it, then you're not considered a psychologist. Yeah. Yeah. So those who want to explore this route, they usually get exposure as associate psychologists. Maybe they are limited to certain types of services lah. Yeah.
Right now, so I think recently I heard that you attended a program that is related to well-being. Would you like to share a bit more about that?
So basically, I went through training to learn how to facilitate like well-being or like support circles. I guess like most often when we like just chat with our friends or like rant to people or to our close ones, right? It's something that's like to reduce the stress, to something that like you just want to get it off your chest, right? But most often there is no conclusion to it. After you rant about it, after you talk to it about with your friends, right? You actually do not even know if that issue is solved. You don't know like, so what do I do now that I've released all my stress? So what I learned through that facilitation is well-being circles or like social support, right? Not just, it's more so structured. It has a structure to it such that it not only analyzes that issue for you, but it also acknowledges whatever effort that you are trying to put into that issue. It helps you to, I guess, like break down what that issue is. It also helps you to process where you are at with that issue and sort of helps you summarize as to where are you going towards with that issue. So there's like a complete circle when you go through such a well-being circle or such a social support group lah. Yes. And that I think was the most interesting thing because I feel like we, like I said just now, we can talk to our friends about a lot of things, but certain things you feel like, I don't want to say it, I feel so judged. Or you feel like maybe I shouldn't say certain things to certain people. But in a well-being circle or in a social support, we as facilitators are trained to create psychological safety so that whoever is there to share their issues, they feel safe enough to talk about it. They feel safe enough to be vulnerable with the issues that they are struggling with. It can be very, very simple things that can happen in their day-to-day life. It can be things that need further attention as well. Yeah. So this is the sort of training that I've been to. Why I decided to take up this training? Because I realized like it's not easy to support people. Because from that training, right, I realized that most often when you talk to your own friends or about issues that people are struggling with, right, we tend to jump into solutions very quick. The first thing that we lack is actually acknowledging the effort that they put in, acknowledging where they are with that issue, or acknowledging their current mental state with that issue. I feel like that's the first thing that we miss out totally. Yeah, it's the same with our patients, to put it into perspective. You don't tell your patients, I know you're trying really hard. No, you quickly tell them, do you want to speak to the doctor? So it's like, you just jump into like solving the problem. You totally don't even tell them that like you are doing well or like it's okay to feel sad or it's okay to experience this, So adding that bit of structure, right, will really take up, it will change the way you see yourself when you speak about certain issues. Yeah. So that support circle is structured in a way that people who are in that circle, they will not only learn to practice like this specific, I guess like specific skills. It's meant to help people to speak better, listen better, and also be more empathetic when they speak to people. So in specific, it's like they empower others. So empowering others can be by encouraging them, by acknowledging their feelings. So you empower others. They can also take on different perspectives. So sometimes we just end the conversation with like, oh, okay. And then you don't care to find out like, hey, so what do you try? Or like, how can I help you? Or, those sort of questions that helps them to grow. You don't take on such perspectives when you're like rushed for time, things like that. So support circle specifically sets a time where people can be curious about others, be curious about their situation, be curious about their issue. That helps people to like feel like, oh, someone is actually caring. They want to know more about me. They want to know more about my struggles. That sort of perspective lah. Yeah. Not only that, I guess like being present for somebody else, I've realized is like actually increasingly difficult when you have your own things to deal with. So that being in that social circle, being in that well-being support or training to be a facilitator for that, right, helped me to be like someone that wants to listen to other people's issues. When you're being present, I don't want to think about like the workout I'm going to do later. I want to think about what is she going through? What does she need? How can I help her? So
like you've
that,
already set the time.
correct, yeah. So that I think is something that if you're keen in, that's what wellbeing circles are for. Yeah.
Would you call it like a very structured peer support system?
It is structured peer support system, yeah, where everybody gets to assess like how they feel before, how they feel after. Yeah, what are they going through and what do they want to do about that issue? Do they want to gain clarity about it? Or they actually already know what they're going through, but they're stuck. What they want to do next, that sort of a thing. So when they come out of that circle, they feel like they reflect on it and they know like, okay, so this is where I'm at with that issue. I need to move on to this. Or like I'm already moving on, so I just need to keep going. I have the support that I receive.
What are the profile of people that attend these circles? Like people voluntarily go for the well-being?
Yes, correct. Some organized by it's by organizations. So I guess like corporate, they have a lot of these well-being circles because it's a high stress, I guess. So they have these well-being circles to support their colleagues. Other groups of people that I've worked with is actually caregivers. So caregivers who are like caring for like their elderly parents, caregivers who are caring for like special needs children. Yeah, so these are spectrum of people that I've worked with. I've also worked with like any people who just want to try what's a wellbeing circle like. Yeah, they come in with like no issues and then they realize like, oh, actually I do have issues that are like that I need to talk about, Yeah, so it makes them think, it makes them reflect. Yeah, it helps them to be more aware of where they are with their mental health.
How many in the circle?
We try not to exceed beyond 5. So it's like 5 like the next. Yeah.
Are they like, for example, in that circle, they are experiencing the same problems?
No.
So like you say caregivers, all of them are caregivers that kind.
Correct. So all of them are caregivers, but they can be experiencing like different issues. Some people might be experiencing issues with like burnout. Some people maybe like specifically time management. Some people maybe with their own physical health, So everybody might come from the same sample, but then like they are experiencing different issues. Yeah.
So like this well-being circle thing, right? They did come to my school. So we do have like a module about mental health well-being. Then they did conduct this well-being circle during classes lah. So whatever Naf said, psychological safety is actually the most, is like a requirement lah, in order for someone to be able to share safely lah. So because like during class, right, I was able to share more. I was able to share without fear lah. But I'm not too sure if here, because like the proximity of working with people from different parts of the workplace hierarchy and like different circles, I'm not sure like people will uphold that safety by not giving any judging behavior lah. But if you do want to experience this, I suggest you can join
Yeah,
circle,
you can-
just as a participant, not like a facilitation lah. I did find the experience very, because I did it as a participant. I did share with my classmates lah, like about life. Yeah, so it's a nice experience. Yeah.
I mean, going back to that psychological safety at work, it's not that some people don't feel psychologically safe to share, but they might also be the kind of person who's like, oh, I don't want to talk about life at work.
Yeah.
Like, they just want to separate it.
I think that's fine. It's a boundary that we need to
Yeah.
respect as well.
Yeah.
Yeah.
Yeah. So that's all.
So it doesn't have to be through just wellbeing circle, social support also. Like I mentioned earlier, like what sparked the interest was actually like the interesting way of like approaching mental health through card games, through wordplay. Those sort of like people are taking more creative approaches to mental health, and I guess like that is worth exploring because it takes away the stigma from like blaming people or like shaming people. Like you're not here in the wellbeing circle to point out this person who hurt you, yeah. So the point of it is to support people, and if a wellbeing circle cannot help, what other ways can we do it? Can we do it through activities? Can we do it through games? Something else that can make people feel seen, feel supported, feel acknowledged and empowered. Yeah.
I'm just wondering, so let's say if someone has have a mental health issue and they go to this wellbeing circle, right? Will there be instances where they break down and then you need to do psychological first aid? Then do you have referral channels to resources outside?
Yeah, as a facilitator, we are trained to give psychological first aid. It's a level 1 psychological first aid, which means you can identify those that need further intervention. So we have resources that we direct them to. We also know how to handle a situation should it trigger the participants. So it takes a bit of practice. So after sitting couples of rounds of facilitation, then you get your certificate to be a facilitator. So it takes practice to recognize who are the ones that need the support, who are the ones that are need more help with their issues.
I think we've learned quite a bit from Naaf and Zub about well-being, and I think if we just kind of look back at what we talk about the mental health continuum, which is a spectrum, healthy to severe. We share about coping strategies. I think there's a lot more coping strategies that we haven't really touched upon also because we just explored what we have been using. Naaf also shared about the program that she's attending to help facilitate in a support group. Yeah, and I think these are very important for us to be aware about, that there are these resources available. But of course, to condense everything into one episode of a podcast is not enough lah. So I guess we're gonna bring them back for a second episode, right? Yeah. And hopefully we get to explore more of the card game that Zub has also. The one where, yeah, because we saw the cards. The card is called What Truly Matters, and it really makes you think about what truly matters to you, literally.
Okay, thank you, Zub and Naaf, for chatting with us about mental well-being and also mental health. Yeah, like what Atika said, we might not have covered everything in this topic. So yes, very possible to see the both of you again in the near future.
Yeah, thank you. And if you have any burning questions, you can check out the feedback section on our website. Please feel free to leave feedback, more episode suggestions, or encouragement for the speakers or hosts. We would love to hear from you.
Hi, please rate, review, and subscribe. Follow the podcast on Spotify, YouTube, or wherever you get your podcasts. Okay, thank you for listening. This has been your dose of content for things related to integral to radiation therapy.
See you in the next episode. Bye.